So I'm so excited you decided to come in today. I know we had previously spoken about possibly doing some Botox, but you had some concerns, so I wanted to go over some things with you and give you an opportunity to ask some questions.
Okay.
So what areas of your face bother you the most, and what are you really interested in the outcome being? What do you really want to get out of this?
Right now, it's right through here.
Okay.
And then, of course, right here by my eyes.
Gotcha. So right in through here, we're dealing with those little crow's feet. And then up and through here is our good forehead lines. And you and I are very similar. We're very expressive people. We like to talk with our eyes and cut up and all of that. Of course, that does leave us with some of those lines. And that's something that Botox can help out with as well. What's interesting about Botox is it helps the muscle to actually relax because it's a derivative of a neurotoxin, and that's going to block the muscle from accepting what it needs to contract. It's not a permanent solution. It's something that can last between 4 to 6 months, and it can really help to actually prevent signs of aging later down the road. Studies have shown that the more frequently that you do it, or if you just maintain normal upkeep, and if you start at an earlier age, you can go longer without getting it and use less product. So there really is that definitive data that says, of course this is going to give us a great look for 4 to 6 months, but 2 years down the road, I'm not going to see those lines that I used to see, or I may not see those lines that my sister has that's 3 years older than me,
Right.
because I've been doing some preventative care. What other concerns do you have about Botox?
One of my biggest fears is, does it hurt? And is my
Okay.
forehead going to be completely frozen?
Got it. So, first of all, I can't say that it's pleasant. It is, in fact, a needle. However, it's a hypodermic needle, so it's going to be almost, it's going to be really difficult to see, number one, but it's the same type of needles that diabetics use. So this is a needle that people every day have to use between 4 to 6 times a day.
Okay.
They wouldn't let them do it if it hurt all the time. Again, the face is sensitive, so there will be a prick. It may be a sting. I find most people actually hear the injection rather than feel it because the needle's so small. But really, I've never had someone say, you need to stop, this is hurting me. It's a really easy, quick procedure, and it shouldn't be painful.
Okay.
And in terms of your forehead being frozen, that would be the opposite of what we want to happen. We still want you to have fluid movement, but we don't want you to have anything that is static. So we don't want some of those wrinkles to be fully in there and firm and deep. And this is just going to help soften them.
Okay.
Now, in terms of units that you would use, it's different for each area of the face. Allergan, which is our company that provides us with our great product, is going to be saying that we need about 20 units in through here to help alleviate the angry 11s.
Okay.
And that's that furrowed brow when people kind of just give you that confused or upset look. You don't always need that much. It really depends on your age, your genetics, and really if that's a facial expression you use a lot. In through here in your crow's feet area, between 6 and 12 units on each side. It all varies. If you're someone that has been in the sun quite a bit and has not done sunscreen, or just, is much older, yeah, there's going to be more product that needs to be used. I always tell people, if we were in a dream world, what the absolute best outcome would be if we used as much product as we really needed to. And then I tell them what we can afford, because that's always part of, the plan in terms of treatment. And we have to be realistic with outcomes. So, it's a give and take, and it's really about your comfort level too. We don't have to do everything today. We can start with something, and then if you feel like, oh, this is something that I really enjoy, or I do feel like I'm rested, then we can go back and kind of touch up areas that you've noticed more.
Okay.
And in your forehead, it's very subjective. So it's going to be more about where the lines are, how deep they are, and how many you have. So it can vary between, 6 to 12 units to 20 units just in the forehead alone. But I do have to caution everyone with the forehead, we have to treat in some capacity this area here. If we don't, we'll get a really heavy look, because this medicine is making these muscles relax, and it'll look like we're tired or angry.
Yeah.
So something to think about. But
Okay.
what are your other concerns? Anything?
I don't think so. I think that's it.
Okay, and I did want to cover the aftercare. So after we do Botox, we don't want you to lie flat for 4 hours and squish your face down on something. You know, that's really going to spread the product to places that we don't want it. And because the product is so small and concentrated, there's a real art and a science in terms of where we place it. So we don't want it to be pushed around by pressure.
Okay.
Another thing is just be gentle to your face. You wouldn't want to go do a chemical peel or a really abrasive exfoliating treatment. And really stay upright for the next couple hours is the biggest thing.
Okay.
After that, there's not a whole lot that you have to worry about. Within the next 20 minutes after an injection, you may have a small bleb or tiny little bump where the medication is, and that's fine. It's gonna absorb into your skin or into that area there in that muscle, and you won't see it later. So you could even go to dinner afterwards and all of those things.
Okay.
There are some medicines and some things that you want to avoid if you're going to get Botox, but we can go through a whole list of that when you come in next time and we actually do it.
Okay, sounds great.
Awesome. Good deal.